Here we are going to talk about the myasthenia gravis. Myasthenia gravis is an autoimmune disorder and that causes the severe muscle weakness. So causes by auto antibody that is interfere with acetylcholine at neuromuscular junction and characterized by the period of exacerbation and remission. In this picture, we can see this is the terminal end of the neuron, and where we can see the vesicle, and vesicle supposed to release the neurotransmitter acetylcholine. So the problem here, this neurotransmitter supposed to be accepted by the next receptor in the muscle. So this area is called neuromuscular junction, where the neuron is end and muscle tissue start. So myasthenia gravis causes by antibody that interfere with acetylcholine at neurotransmitter junction. Let me show you another picture. It could be more easy. Here you can see this is the acetylcholine vesicle and this is the receptor. Receptor is supposed to receive this vesicle and go for the next level. Next level means muscle action. But in this picture, this receptor is not working like normal because antibody that interfere with acetylcholine absorption by the receptor. So what are the definition wrote here? They said it is the neuromuscular disease characterized by considerable weakness and abnormally fatigue of voluntary muscle, means skeletal muscle, muscle in the hand and legs especially. A defect in the transmission of nerve impulses at myoneural junction. Myoneural means where the muscle and neuron is joining part. You see in this picture, the terminal portion is called dendrite, and in the dendrite, we can see ending where the vesicle go, open up, release neurotransmitter, and neurotransmitter received by the muscle tissue. The problem is here. And causes include insufficient secretion of acetylcholine or excessive secretion of cholinesterase or unresponsive of the muscle fiber to acetylcholine. Ultimately, the basic pathology of the disease, autoimmune, affect the myoneural junction or lack of acetylcholine. This is the pathology. Who affect most? Usually women, age group 20 to 40 years, means young adult. Frequently more attacked than the man. Men usually 60 to 70 years old, means late stage attack more. What are the symptoms? Weakness and fatigue, difficulty of chewing and swallow, dysphagia. So in this picture, we can see the upper eyelid muscle is weak and dropping. We call ptosis, right? Patient also problem of diplopia means double vision, dropping the eyelid, incontinence, muscle weakness, and dysphagia. So here we go, and we can see the sign symptom of Myasthenia gravis. Patient has a breathing difficulties, difficulty of chewing and swallow, means eating difficulties, easy way to explain. Difficulty of talking, dropping and position of the head, change the voice, facial paralysis, fatigue, and weakness of eye muscle, dropping the eye muscle. So here in this picture, we can see upper eyelid is dropped because paralysis of the muscle. Eyebrow, you see, it is dropping the corner of the mouth. Other here, if we go, you see the presentation of the patient. Extraocular muscle and also double vision is called diplopia. Eyelid muscle dropping called ptosis. Facial muscle paralysis, swallow problem, fatigue, difficulty of speech, and the problem is getting worse if they use the muscle more. Weakness, worse with activities, and improve with the rest. This is very typical nature of Myasthenia gravis. Let me go back. Next here. In this picture, we can see same one, ptosis, diplopia, weak and hoarseness of voice, breathing problem, diminish the breath sound, and very late stage respiratory muscle paralysis and failure. And patient die because of this problem. When patient come to the hospital and when you deal with them, the most common presentation are voluntary muscle weakness and increasing with activities. And also, we have to tell the patient, do not use this muscle too much, have to take the rest and preserve the energies. And in the late stage, patient develop the swallow problem, speech problem, right? And finally, the end stage, they die because of respiratory muscle paralysis. What else? What are the intervention? Monitor the respiratory status and ability to cough and deep breathing techniques. Monitor for respiratory failure and maintain the suctioning and emergency equipment at the bedside if need, right? So next intervention here. So monitor the vital sign, monitor the speech and swallow, encouraging the client to sit up when eating. Assess the muscle status, reinforce the instruction to the client to conserve the strength so that they can use it when needed. Plan of short activities that coincide with the times of maximal muscle strength. Monitor for myasthenics or cholinergic crisis. Assist to admin anticholinesterase medication. Also, re-educate to instruct the client to avoid the stress avoid the infection, avoid the fatigue, or over-the-counter medication. So nursing intervention is super important. So maintaining the patient airway means oxygen, suction, or intubation equipment always be ready at the bedside. We have to encouraging period of rest and also provide small frequent food. Usually for this patient, it is good to give them high caloric meal and also have the patient sit upright while eating and also thicken the liquid. What next? Reinforce the instruction to the client to wear a medi-alert bracelet. Also re-educate to the client about services from Myasthenia Gravis Foundation. In this picture, we can see the eye drop. The problem, this eye will be open during the sleeping time. If constantly eye will be opened, patient chance to develop ulcer. So always tell your patient administer lubricant eye drops and tap eye during the night time. So to prevent the damage of cornea. So myasthenia crisis. Before to go myasthenia crisis, I want to tell you, we give the treatment for this type of patient anticholinergic agent, okay, or we give them neostigmine. Anticholinergic agents most commonly used pyridostigmine or neostigmine, and also we give immunosuppressant can work. Myasthenia crisis the crisis is an acute exacerbation of the disease. So myasthenia gravis is an autoimmune disorder and chronic disease. But when attack occur, we call acute exacerbation of chronic disease. And the crisis is caused by rapid, unrecognized progression of disease or inadequate amount of medication if infection, fatigue, or stress act as a trigger. If your patient have myasthenia crisis, what are the signs and symptoms? Increase the pulses, respiratory rate, blood pressure, dyspnea, anorexia, and cyanosis, bowel and bladder incontinence, decrease the urine output, absence the cough and swallow reflex. Very important for NCLEX board exam. What the intervention or interaction? Monitor the sign of myasthenia crisis and increase the anticholinergic medication as prescribed. And next here, cholinergic crisis. Cholinergic crisis result in depolarization of motor end plate. This crisis causes by over medication of anticholinergics. So The major sign and symptom of cholinergic crisis: excessive salivation, lacrimation, urination, and defecation. Excessive saliva secretion for salivary gland. Excessive lacrimal uh, tear secretion from lacrimal gland. Excess urine production, urination increase, or increase the defecation, right? This is a common sign of cholinergic crisis, shortly called SLUD. What next? What are the tests basically we do to diagnose the Myasthenia Gravis? The most common test we do is called endophonium test. So other name of endophonium test is called Tensilon test. Endophonium or Tensilon test uses the drugs called Tensilon or drugs called endophonium to help your patient to diagnose the Myasthenia Gravis. And Tensilon basically prevent the breakdown of the chemical acetylcholine. That is a neurotransmitter that nerve cells release to stimulate the muscle. So a positive Tensilon test or a positive endophonium test confirm the diagnosis of Myasthenia Gravis. Let me read it. Have atropine sulfate available when perform this endophonium test? The test is performed by neurologists to diagnose Myasthenia Gravis. The test displays the client at the risk for ventricular fibrillation and cardiac arrest. Here, to diagnose the Myasthenia Gravis, endophonium injection is administered to the client. Positive for Myasthenia Gravis, the client show improvement of muscle strength after the administration of endophonium. What we called the positive endophonium test or Tensilon test, and that is confirmed patient have Myasthenia Gravis. Negative for Myasthenia Gravis, the client show no improvement of muscle strength, and also when we administer endophonium, which increase the acetylcholine at the neuromuscular junction, if the symptom is improved, it is Myasthenia Gravis. If not, it is a cholinergic crisis, or we have to keep atropine as an antidote, right? So in this picture, we just left again cholinergic crisis sign symptom. If cholinergic crisis, give them atropine as an antidote, right? Next here, in a short review, before to finish, the sign symptom, but I want to tell you the patient, when you have diagnosed the Myasthenia Gravis, we give them anticholinergic agents, or we give them the medication pyridostigmine or neostigmine or immunosuppressant.